Hello everyone, welcome back to our channel. My name is Margot. I'm the coordinator of GameMed English by Sehant. Thanks for staying with us. Today we have the first interview of Meet the Expert series, and it will be dedicated to cancer in pregnancy. Our guest is an oncogynaecologist, leading scientific researcher, surgeon from National Cancer Institute, medicine doctor Nataliya Tsip. Greetings, Nataliya Pavlovna.
Good evening, Margarita.
We deeply appreciate that you found some time to join us for this talk. So let's start with the background. What is pregnancy-associated cancer and why is this topic important?
Pregnancy-associated cancers usually defined as cancer diagnosed during pregnancy or within the first year after delivery. In general, cancer during pregnancy isn't common. About 1 in every 1,000 pregnant women are diagnosed with some form of cancers. Most statistics don't include cases of pregnancy-associated cancers when the pregnancy was terminated in the first 2 trimesters. So these rates may be underestimated. The reason why it is high time to learn about cancer in pregnancy is that the number of pregnant women with cancer increases. More women are waiting until they are older to have children, and the risk of developing most cancers increases with age.
So which cancers are usually diagnosed in pregnant women?
One of the most common types of cancer that affect women during pregnancy is breast cancer. It is diagnosed in about 1 in every 3,000 pregnant women. Other common cancers diagnosed during pregnancy are cervical cancer, Hodgkin and non-Hodgkin lymphoma, ovarian cancer, melanoma, leukemia, thyroid, and colorectal cancers. Such tumors as lung, brain, or bone cancers can also occur during pregnancy, but they are extremely rare.
And is it more difficult to diagnose cancer during pregnancy?
Yes, both diagnosing and treating patients with cancer during pregnancy is the most challenging. There may be a diagnostic delay because certain symptoms of cancer may overlap with pregnancy symptoms. Common signs of both pregnancy and cancer include bloating, headache, nausea, vomiting, fatigue, breath changes, and rectal bleeding. So, if the patient is presented with such symptoms, the doctor should be extremely attentive and, if necessary, may order some additional examination. These include X-ray, CT scan, MRI, ultrasound, biopsy, etc. But before that, the doctor should confirm a viable pregnancy and determine gestational age. The specialist should also exclude fetal anomalies by ultrasound.
I see. Which factors are leading in the decision-making of the diagnostic method?
There are 2 core factors. The first one is gestational age. So during the first 7 weeks, the embryo is the most susceptible to radiation. The use of ionizing methods may result in the death of embryo or congenital anomalies. In week 8 to 15, the exposure may induce the growth or severe mental retardation. Starting from the 16 weeks, there is a low risk of mental retardation. The second factor is the radiation dose. There are estimated threshold doses for each of the period I have mentioned.
I see. So what about the profiles of the diagnostic methods? Which one is considered to be the safest?
The safest method is ultrasound. However, even for it, there is a threshold ultrasound beam to reduce the risk of fetal tissue heating. An MRI uses magnets and a computer, and it's believed to be a safe test for pregnant women because it doesn't use ionizing radiation. Still, MRI at high magnetic field stress should be avoided. An X-ray uses low doses of radiation, and the level used isn't high enough to harm a unborn baby. Still, pregnant women should cover their belly with a lead sheet during an X-ray when possible. Regarding computer tomography, CT scans of the head or chest are typically safe to have during pregnancy. A CT scan of abdomen or pelvis should only be done during pregnancy if it's absolutely necessary. The patient should also wear a lead sheet during a CT scan. The diagnosis of gynecological cancers is especially complicated as it involves the examination of the cancer-affected organ in which the fetus develops.
Then what are the main principles of diagnosis and treatment of pregnant women with cancer?
First of all, they require a multidisciplinary approach. A team of healthcare providers usually includes obstetrician, neonatologists, oncologists, chemo, and radiotherapists. Even more, the woman undergoes double stress associated with both pregnancy and cancer. She is always concerned with her child's well-being, so psychological assistance is needed. Doctors ensure adequate staging and treating based on morphological features.
Right, so which options of treatment are available to the patient with pregnancy-associated cancer?
Today, there are three methods commonly used in pregnancy: surgery, radiotherapy, and chemotherapy. The choice is made based on the gestational age and type of cancer. The surgery can be used during the whole pregnancy. Breast radiotherapy is available in the first and second trimesters. Pelvic radiotherapy is contraindicated during pregnancy. Lastly, chemotherapy is possible in the second and third trimester.
Are there special conditions of surgery in pregnant women?
Yes, the patient should be positioned under the left lateral tilt. Fetal monitoring should be provided during the intervention if possible. After the operation, the patient should receive appropriate pain management, and the minimally invasive surgery is available before 28 weeks of gestation.
And what about the requirements during the chemo and radiotherapy?
First of all, we check for preterm contractions to prevent miscarriage. We should also monitor fetal well-being, growth, and morphology after each cycle. The use of chemotherapy method is possible after 35 weeks of the gestations, because chemotherapy may lead to severe neutropenia and septic complications as a result.
I see. Then is the termination of pregnancy required to ensure the best outcome of the cancer treatment for the woman?
No, termination of pregnancy doesn't improve the prognosis. In some cases, the patient might have to have this earlier than planned, but still cancer doesn't need to pregnancy to be terminated. A team of oncologists and of gene specialists will have to cooperate during pregnancy. So the patient will have to pay more attention to her health and have more appointments in the hospital.
So if the patient decided to prolong such pregnancy, is cesarean section compulsory in her case?
No. The mode of delivery is determined by obstetrical indications and is not affected by cancer. The preferable timing of delivery is after 37 weeks, as the fetal brain is already mature in this period. It is also advisable to deliver at least 3 weeks after chemotherapy. In cases when a preterm delivery is inevitable, fetal lung maturation is required.
And what happens after the delivery?
In the postpartum period, the placenta should be examined for metastatic disease. Experts don't know all the ways that cancer can affect the baby. Though it's possible for some cancers to spread from the mother to the placenta, most cancer really have a direct effect on the fetus. There have been very rare cases of cancers, such as melanoma or leukemia, spreading from the placenta to the fetus. Breastfeeding is physiologically possible after radiotherapy, and it's contraindicated after chemotherapy. The standard oncological treatment can be continued as soon as possible after vaginal delivery and 1 week after uncomplicated C-section.
So where may students learn more about this topic?
The International Network of Cancer, Infertility and Pregnancy INSIP is an organization initiated by our professional group, the European Society of Gynecological Oncology, to analyze the existing information about gynecological cancers in pregnancy. Since 2014, INSIP developed and updated the guidelines of diagnosis and treatment of gynecological cancers. So you can look the latest information in the 3rd edition of such guidelines.
Okay, so let's finish this up with the take-home message. What our students should have learned from this meeting?
Firstly, the pregnancy of a woman with cancer may be prolonged if the woman wishes to do so and there are no fetal anomalies. Secondly, before the beginning of the treatment, the woman should be examined according to the gestational age. The stage and morphology of the tumor should be established. And lastly, the planning of treatment should be performed by the multidisciplinary team, including psychological support.
Okay, so this is it for today. I hope this was useful for our participants. Please don't forget to leave the comments in the section below. I also would like to thank Nataliya Pavlovna for being with us. Thank you so much.
Thank you for having me.
And don't forget to subscribe to our YouTube channel and have a nice evening. Bye-bye.
Bye.